of saving teeth, or if a tooth has to be removed, what are the benefits of a dental implant? Dental implants are actually made out of titanium, which is a very called biocompatible, which is it's a metal that actually becomes integrated within the body. They make all kinds of joints with them for replacements. They're using as plates, and screws are made out of titanium. And so dental implants are basically a screw that's placed into the jawbone. Within that screw, that eventually over time, for a few month period of time, bone literally starts growing into the micropores of this surface of an implant. And as that implant goes in there, it actually becomes part of it. And so when that happens, it can be used just like a natural tooth could be used. So the question is why are implants better off, or why is it better to have an implant in versus having a tooth pulled? Well, one of the benefits is that it preserves bone. Bone is like muscle. I use the analogy of muscle. And muscle is, if you work out and exercise, then muscle will continue to grow, get bigger, get stronger, more dense. If somebody is, let's say they're laid up or they're sick or they're in bed and they can't use their muscles, they don't exercise, those muscles will shrink down and get smaller. The body, if it's stressed, it'll respond by creating more muscle if it's needed muscle. In the same way is with the bone. Natural teeth that are placed in the jawbone or an implant that's placed in the jawbone will maintain the integrity, thickness, volume of bone that's there. The problem is when people get their teeth removed with dentures, the dentures will actually start, after it's removed, the bone around it starts shrinking down, and unfortunately once the majority of that bone is gone, it really can't be replaced with real conventional means, and it takes a lot to try to bring that bone back. We do and can do some grafting to help maintain some thickness of bone and gain thickness of that bone, but it's, there's quite a bit to it. The best thing is to place an implant right after tooth is removed, if it can be, and if it's thought of, and if it's done properly. An implant can be placed directly after tooth has been missing. I've had patients who their front teeth have been broken off or something like that, and we'll take the tooth out. Sometimes they're just local numbing anesthetic that we use, just a numbing or maybe some gas. Place the implant in there, screw that implant down, put a temporary crown over the top of it, and it looks great. It's not completely functional, but it looks good. It's a great replacement. It's a wonderful process. If we can do that, that's the best. If we can't, then sometimes we'll have to take that tooth out and do what's called a fixed bridge, where we have to use the adjacent teeth to that space and put what's called a fixed bridge in there. But unfortunately, over time, that bone, once again, it's stimulated from within, and it's not loaded. Then, therefore, if it's not loaded, then it will eventually start to shrivel down and shrink over time. So dental implants are, right now, we consider it the standard of care. If a dentist is going to be placing it, taking a tooth out or recommending it, the replacement of that, and things that really should significantly be considered is having an implant placed in that location to once again preserve the bone, and because once the bone is gone, it's gone, and that affects your shrinkage of your mouth and all the soft tissues that are around that. So, okay, so if there's any questions, you can call our office at 586-247-3500 or visit us at thegentledentist.com.